उडची ना न्हीद बरी पडटली सो ते वखदाचे तूं पयशे सेव करता you are going to save a lot of money by just your attitude to your elderly person.
Correct. Absolutely. Yes. मोहित डॉक्टर आमकां एक प्रश्न आयलो आसा. हॅलो हॅलो
Hello.
हां
Hello, doctor.
हां विचारात.
Doctor, I wanted to ask about my mother.
Yeah.
Mother, who is 82 years,
Yes.
and she has arthritis. And she also gets urinary infection very often. So I was just
Is she
wanting
diabetic?
to know what I can do about it.
Is she diabetic?
No, doctor.
Okay.
No, doctor.
See, generally an elderly woman or an elderly lady who's beyond the age of 80 or even beyond the age of 60 do normally get constant urinary tract infections. It is common in the patients that we see on a regular basis. What you need to do is you need to actually see a doctor and test her properly for what is the urinary tract infection that she has got. You need to do a culture. You need to do a culture sensitivity to check which antibiotic has been given to her, whether that antibiotic is the right one. So you need to see some specialist who understands this, and then once you see that and once you sort that out, they will treat her, and then possibly later on there are so many other options like urinary probiotics that could be started on a regular basis, so this does not happen. That is one, if she already has an infection. The other one to prevent would be good hygiene. You have proper toilets, you have proper washing facilities, as and when you use the toilet every time, hot water wash would be an ideal way to prevent an ascending infection from taking place. So these are the two things that you should look at. As far as arthritis is concerned, it is a degenerative process. I can't say much about it other than if it is really bad and if your orthopedic surgeon suggests that you have to do a knee replacement, then you need to do it if it's a knee joint arthritis. So these are two things that I would like to suggest to you.
Correct. And in case if there is something like osteoporosis or this
Yeah,
thing, then again there are some injections which can be given.
Yes.
So she will have to consult orthopedician. I think that will be a better option.
And there are some other alternative options also. Like today there are new equipments that are coming in from the Western world, like Switzerland. We have just installed one in Bombay, which is known as electromagnetic radiation therapy, EMRT, which also helps in osteoporosis and osteoarthritis, but in the early stages. You see, if it is not reached beyond the stage 2 and osteoporosis is not very bad, then that electromagnetic resonance therapy does help you. It is being used in the West for this, to prevent it from, to give you a better quality of life and to prevent you from going faster towards a position that you might need a knee replacement or something like that. But these are options that are available and we hope to get them to go to sometime. I hope some hospital does do that.
Yeah, hopefully. Doctor, we are talking about means how to prevent this aging process. You are saying it means how. See, like you are talking about environmental factors. Say, like say you said like about this air, and I will ask you some simple question. Like say, what water we usually consume.
Okay.
I'm not against any policy or something, but my personal perception is that perhaps we are, perhaps you can correct me, that we are consuming more this chlorinated water or other, even our pipelines that lead. How far, means are there any documented evidences to say that these are harmful to the human body?
Yes. There is enough and more evidence to
just
show.
1 minute, just we'll take this call and I would just keep in mind this question. Hello? Hello? हाँ, विचारात.
Hello, sir.
I'm
Sherifa Sayyed.
हाँ.
माझे लेफ्ट साइड काळजांमध्ये धडधडता केन्ना दुखता.
काय टीव्हीचा आवाज कमी कर मातसो. हॅलो.
हॅलो.
टीव्हीचा आवाज कमी कर आणि प्रश्न विचार.
डावे साइडीन काळजान माझे केन्ना दुखता, गडगडता, धडधडता व्हडल्यान आणि दुखता केन्ना बी.
कितली वर्सां तुका?
कित्यासाठी ते?
कितल्या वर्सां?
म्हाका आता 50 लागला.
आणि कितें वखदां बी घेता?
ना.
वखदां घेता?
ना.
डॉक्टराक मेळ्ळा, ECG बी काढून घेतला?
पयली 15 वर्स पयली बांबोली दाखयलेले. तेन्ना म्हाका म्हणलें जड उखलू नाका आनी न्हीद पडनाशिल्ली, न्हिदेची ती टॅबलेटी दिलेले. ते म्हाजे दूख नाशिल्ले तेन्ना, सांस फुगार जाताले म्हाजे खूब. आता ते बंद झाले आणि काळजान माझे केन्ना बी दुखता धडधडता.
पण आता हे 15 वर्षा पहिलीची खबर सांगता तुम्ही. आता तुम्ही
ना म्हाका आता दुखता.
तशें म्हणणं त्यांना तुमचं आता हाली तुम्ही दोतोराक मिळून ECG कार्डिओग्राम बी काढून घेतला काय विचारता.
ना वचूंक ना.
ओके डॉक्टर.
ना तू पहिले म्हणजे तुवें दोतोराक वचोन तुज्या मेळपाक जाय. खंयच्याय हॉस्पिसियान नाल्यार GMCन वचोन नाल्यार विचार खंयचोय डॉक्टर तुका लागीं आसा तेका वचोन मेळोन पयलीं ECG काडून पळोवपाक जाय कितें प्रॉब्लम आसा जाल्यार. मागीर फुडलें मागीर पळोवपाचें कितें ट्रिटमेंट करपाचो तें मागीर.
अच्छा, सो वी आर टॉकिंग अबाउट डॉक्टर की हाउ वेदर दिस lead pipelines and this chlorinated water. See, this is off the record. See, just for the academic interest, I am asking.
No,
this
no, there is
because against tomorrow people should not feel that we are म्हणजे हाच्या खातीर कितें प्रॉब्लेम आयला अशें फक्त आमी एक academic interest म्हणून हो प्रश्न विचारला.
No, there is evidence that lead does affect you, mercury does affect you, cadmium does affect you. आता कितें जाला, there are two issues. One is the groundwater.
Correct.
So when you chlorinate the groundwater, the metals that are in the groundwater don't go away. The metals पडे असता ते वचना, ते थंयच असता. So that you are consuming.
Correct.
Okay. Now I will come to why metals are bad for you when you consume. But how do you? Okay. What about chlorine? Chlorine itself in excess is bad for you.
Correct.
All right. Now what do metals do? When metals go in, they go and sit on sites where your normal minerals like zinc, magnesium, selenium, chromium, these are supposed to act because zinc is responsible for thousands of biochemical reactions. At least 100 of them are very important.
Achha.
So when zinc is not there and some other metal is sitting there, that reaction stops. That is where the aging process starts. So you don't need this to go inside. So what you basically do is you need to stop this from entering your body. Now you cannot stay without having water. So you put an RO water filter. RO water filter gasla all your metals are out. This is one way of doing it. So we have been advising people, put an RO water filter. Many water experts say, why do you need a water filter? Your soil is not, your water is not hard, etc., etc., etc. No, there is fresh evidence to tell you that very little, not what we consider poisonous, very little amounts of these metals when they enter your body, they cause slow chronic metal toxicity, and this starts early aging. So you don't want that entering in your body. So one way of purifying the water that you drink is put an RO water filter. And आता तुका RO water filter मेळता 10 वर्सां फाटीं तुका RO water filter घेवपाक गेल्यार भरपूर पयशे पडटाले.
कॉस्टली आसतले.
So many small units that you use only for your drinking and for your cooking water. That's it.
बरोबर. सो दीस वन ऑफ द बेस्ट वे. आय थिंक म्हणजे ह्या लोकांनी लक्षात घेवपाक जाय की फक्त म्हणजे टिका करून किंवा ताजेर पिरपीर करपा पेरस जर आमी म्हटलें एक्चुअली डॉक्टरान सांगला जर RO वॉटर फिल्टर जर आमी बसयलो जाल्यार म्हाका दिसता आमचे खुबशे म्हणजे एटलीस्ट ह्या पार्टाचे प्रॉब्लेम तरी सॉल्व जातले.
Absolutely.
डॉक्टर म्हाका आनीक सांगा की आता तुमचे कडेन लोक येतात न्हय की अशे जाणटे लोक येतात आणि तांचे तुमी जो म्हणलें की हें डिप्रेशन किंवा जेंचे हे आता तरेकवार आल्झायमर्स म्हणा डिमेन्शिया आसा ते जर तुमी असं स्लो करतले बट सी यू कॅनॉट अवॉयड कारण समटायम्स इफ इट इज कमिंग इन द पार्ट ऑफ युअर सी तुम्ही म्हणटा ते पळय लॉंगिट्यूड इज इट सेल्फ इज अ प्रॉब्लेम नाव. आमी खूब वर्सां जगता होच एक प्रॉब्लेम जाला. ते जर पयलीं बेगीन केल्ले जाल्यार इतके प्रॉब्लेम परहॅप्स जावचे नाशिल्ले. पण आमी खूब वर्सां जगता आनी दीज आर पार्ट अँड पार्सल ऑफ अवर रुटीन लायफ. आता कितें कांय गजाली आमी पोस्टपोन करूं शकता, प्रिव्हेंट स्टॉप करूं शकना.
No, we can slow it down. You can slow it down and see, whenever you do any kind of treatment or any kind of management of any patient, what is your aim is more important.
Correct.
So, मुझे लगे patient आयले my aim for that patient is always better quality of life.
बरोबर.
You see, better than what she is getting today. With the disease.
बरोबर.
So diabetes is diabetes uncontrolled. If I can control the diabetes, you have a better quality of life. You are having problems with your knee joint. You are not in a position to walk. You don't want to get operated.
Better quality of म्हणजे त्या लोकांचे जीवनमान सुधारचे हो ऑब्जेक्टिव्ह. तर एक आमकां कॉल आयला तो घेया. हॅलो 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 प्रश्न विचारात.
हॅलो
हा
एक 6 वर्साचो जाल्लो आहा न्हू तेका डायबिटीज जाल्या ती जेवत ना कितली टॅबलेटी बी घेता जाल्यार इन्शुरन्स पासून घेता पण देवाना कशी तेजी.
खंय मेळटा तो दोतोराक? खंयच्या दोतोराक मेळटा?
दोतोर
नांव सांगू नाका. खंय हॉस्पिटलाचें
बांदोडकार.
प्रायवेटान न्हय तशें म्हण हांव नांव बरें सोड ओके प्रायवेट डॉक्टराक मेळटा.
हय
आणि पण म्हाका सांगा ताचो आहाराचेर कंट्रोल आसा म्हणजे ताका जशें जोर सांगता की इतके शीत जेवप इतके खावप ते तशें खाता काय आपले जाय तशें खाता
खाता रातचे ताका जेवण ना हय
जेवणा म्हण कितें खाता तो रातचे
रातचे पोळयो दिता हांव ताका
हय आणि
पोळी आनी भाजी
आणि दनपारचे
दनपारचे इल्लेशें शीत फुल्यार भर
आणि तेजें वजन कशें आसा
वजन पळोवंक ना तेणे पळयलं
नाही तशें नाही म्हणजे बारीक आसा काय लठ्ठ आसा
आहा बरो मस्त मोठोच आहा
हा मातसो मोठो आसा चलता कितके वरां
चलता तो म्हापसा वयता येता अशें करता
म्हापसा खंयसून वयता मागीर चलता कितको वेळ
आं
नाही म्हणजे अर्दो वर तरी चलता अशें विचारता हांव प्रश्न
सांग हय सांग तुगे बेगी गुलू गुलू
हा कितको वेळ चलता अर्दे वर
पावण वर चलता
हा पण डेली अर्दे पाऊण वर सकाळचो आणि सांजचो चलता शुअर
ना एक दीस ना मदीं
पळय डॉक्टर ओके यू आन्सर दिस क्वेश्चन दिस इज ऑल्सो इम्पॉर्टंट आयकात
पळय तुका जर डायबिटीज जाल्यार तुजें एकूय वखद चलचें ना तूं एक्सरसायज करना जाल्यार तुजें म्हापसाचें वचपाचें येवपाचें तें अर्दे वर चलपाचें
काय बाजारान भोंवता आसतलो
तें कोंताक येवचें ना बाबा तुवें डेली सकाळचें च्या पिवचे फुडें एक वॉकिंग अर्दे वर पूण वॉकिंग करपाक जाय
बरोबर
आनी सांजचें जाता जाल्यार आनी एक अर्दे वर वॉकिंग करपाक जाय एक्सरसायज ना जाल्यार तुजी एकूय डायबिटीजची जी वखदां घेता तूं ती लागची ना तुका तूं इन्सुलीन घे कितेंय घे
बरोबर
एक्सरसायज इज व्हेरी इम्पॉर्टंट आनी तूं तर मातसो मोठो आसा जाल्यार तुजें वेटूय रिड्यूस करपाक हें बऱ्याक पडटलें
बरोबर
फुडें तुका हार्टाचो प्रॉब्लेम जावचो ना कित्याक डायबिटीज पेशंटांक एक कॉम्प्लिकेशन की तूं जर मोठो आसा जाल्यार ऑटोमॅटिकली तुका हार्ट डिजीज जावपाक शकता सो एकूच सांगपाचें म्हणल्यार तुवें एक्सरसायज रेग्युलरली करूंक जाय रेग्युलरली एवरी मॉर्निंग तूं बरें टॉयलेटीन वता तसो तुवें एक्सरसायज करपाक वचपाक जाय
बरोबर म्हणजे इतको रेग्युलरली आनी रिलीजियस म्हणजे दर दिसा तुमचो एक्सरसायज सामको इम्पॉर्टंट डायट कंट्रोल ना आसूं तें पळय कितें जाता तें जाता म्हणून खाता अशें म्हणून खावपाक जायना यू हॅव टू बी व्हेरी रिलीजियस म्हणजे सामकें चुजी आसपाक जाय जशें डॉक्टरान प्रिस्क्रायब केला इनफॅक्ट आतां डॉक्टर सामको एक तुमकां एक डायट शीटच दिता किंवा दनपारचे कितले खावचे सकाळचे कितले खावचे सामकें त्या प्रमाणे रिगरसली फॉलो करपाक जाय तरच तुमची डायबिटीज कंट्रोलान येतली बट आपल्या मनान मात्र तशें करूं शकना डॉक्टर म्हाका दिसता एक वी आर ऑन अ व्हेरी इंट्रस्टींग डिस्कशन जस्ट एक ल्हानसो 2 मिनटाचो ब्रेक घेवन परत सुरू करूया